Welcome, everyone. I have just opened up the gates. This is one of the coolest things, being the host of a webinar, when you get to hit that start webinar button and see people attend. So as everyone is joining us, my name is Jackie Eaton, and I am the Community Action Program for Children Training and Education Coordinator, also CAPC, Training and Education Coordinator, and I work at the Saskatchewan Prevention Institute, which is located in Saskatoon. We are a provincial nonprofit organization, and so we do service all communities across Saskatchewan. So I am excited to see we have many people registered for this webinar, and we know a lot of you are from this province, but I also noticed we have people from all over the country as well as international. So welcome to you all. Before we get started, I do just want to start with a land acknowledgement. So the Prevention Institute is located in Saskatoon, and that is where I am residing. So I live, work, and play on Territory 6 and the homeland of the Métis. But because the Saskatchewan Prevention Institute does service people from all across the province, we want to acknowledge the treaty lands of 2, 4, 5, 8, and 10, in addition to Treaty 6 and the homeland of the Métis. And I would encourage you just to take a moment and consider what lands you are on and what that land means to you, and thinking about the spirit of reconciliation, how the connections you make to the land and to the people who have come before us, what that means for you. And I encourage you or welcome you, if you wish to share in the chat what treaty land you are on, that would be fantastic. So just as a reminder, and you wouldn't have signed up unless you knew the title, but the title of this webinar is Supporting Children with Autism, Diagnosis, ASD Information, and Strategies. And you would have noticed when you joined that the webinar is being recorded, and we will be sending out the link to the recording to all registrants. So we know that there were some people that were unable to attend in person, but you will be getting that link, as well as we will be putting the recording on the Prevention Institute's website. So once it is ready to go, and it usually takes us a couple of days, then we will send out that link for you to share. Very shortly, once Almasa and Lauren start, I will be uploading a PDF of their presentation, of the entire presentation. So you'll have that at the start. And at the end of the presentation, they have several resources that I will also be putting in the chat that has information that will be of use for you after. We encourage you to use the Q&A function. So at the bottom of your screen, you should see a Q&A button and a chat button. If you have any questions, please put them in the Q&A, as at the end of the presentation, we will be going through that. And so rather than us having to go through the chat, that will be an easier process. At the end of the webinar, or at any point, if you do have to leave, once you close the end webinar, a link will come up in your browser with an evaluation link for the webinar. And it is very short. It will only take you a couple of minutes. We would really appreciate your feedback and input, as that really helps us look at how to plan for future webinars. So we would appreciate that. And I think that is all I have for now. Thank you so much to everybody who is already putting in the chat what communities you're from, what treaty land you're on. And I am going to oh no, I'm not going to hand it over yet, because I have to do the introductions. So we are so delighted that we have two people from Autism Services Saskatoon. Almasa Nordstrom is an autism consultant at Autism Services of Saskatoon and has been with the organization for over 5 years. She is a Master's of Education in Special Education Psychology from the University of Saskatchewan, and recently completed her coursework for her board certified behavior analyst certification at the Florida Institute of Technologies. ALMASA supports clients with autism and their families by sharing resources, advocating, providing behavior consultation, and parent training. She also oversees the behavior therapists and the skill acquisition therapy programming for clients ages 0 to 5. She is passionate about teaching parents, educators, and outside organizations the benefits of applied behavior analysis as an intervention for those with ASD and how it can improve their quality of life. In her spare time, ALMASA enjoys spending time with family, reading, and baking. And she is joined by Lauren Brandt, who is the director of the Autism Intervention Program, or AIP, and has been with Autism Services of Saskatchewan for over 10 years. She has a Master's of Education degree, Education Psychology and Special Education from the University of Saskatchewan. She began working for Autism Services in 2013 and has enjoyed working in a variety of positions, including behavior therapist, consultant, that's remote and urban, senior consultant, and currently the director of AIP. Lauren appreciates working with and leading the phenomenal professionals in AIP. She enjoys how the uniqueness of each autistic individual is celebrated and how AIP supports clients and their families in working towards the goals that are meaningful to them. In her spare time, Lauren enjoys reading, puzzling, and spending time with family. We are delighted you are here, and I will pass it on to you.
All right, thank you, Jackie. I'll just get set up with our presentation here. All right, so we are here to present quite a bit of information to you. And if we don't get through it all, you will have the presentation slides and we'll try to get through as much as we can, but we do want to make sure that we're answering some of your questions at the end. So we're going to go over diagnosis, ASD information and strategies, specifically focusing on the age range of 0 to 5 years. Okay, so today we are going to go over characteristics, difficulties, and strengths associated with the diagnosis of ASD, the diagnosis itself and what that might look like, as well as some strategies to go over some of the more common difficulties or challenges that autistic individuals might experience. So what is autism? Really, it's a complex neurodevelopmental disorder that typically appears within the first 3 years of life. The onset is in childhood and it does continue into adulthood. So it is a lifelong diagnosis. It affects brain development and how the brain processes information. And so that means that people with autism may communicate, interact, behave, and learn in ways that are different than others. It is considered a spectrum disorder. So it means that people with that same diagnosis can be vastly different from another person with the same diagnosis in terms of intellectual ability and severity of language problems or degree of progress. So not all people with autism are affected in the same way. It's really important to note that. In terms of prevalence, in 2023, the CDC reported that approximately 1 in 36 children in the US is diagnosed with an autism spectrum disorder. And the most recent statistics in Canada reported that 50% of those aged 1 to 17 years meet the criteria for ASD. It also affects all ethnic and socioeconomic groups. And we found that boys are 4 times more likely to be diagnosed with autism than girls. So along with that is why are girls less likely to have ASD? And it's not necessarily that they are less likely, it's just that they are less likely to be diagnosed, or it's often diagnosed later in life. So it's really looking at that diagnostic piece for girls. Because a lot of what we know about diagnosing children is predominantly based on males, we can be missing really key ways that ASD might sort of affect females or ways that it might show up. So females with ASD are often really good at masking their symptoms and sort of camouflaging in order to fit in with social norms around them. So they might really observe sort of what's going on and try to imitate that so that they're kind of hiding, the symptoms that might present in that environment naturally. And as research progresses, we'll see changes in these statistics. So in terms of the ASD diagnosis and specifically the criteria, generally the DSM-5 is used, the Diagnostic and Statistical Manual for psychiatric disorders. And diagnostic criteria is divided into two main areas. And these are the two main areas that autism is really characterized by. So we've got social communication and interaction, and then restricted and repetitive behaviors. And generally, when a diagnosis is given, a level of support would also be provided. So we have level 1 that might be just requiring support. Level 2 would be requiring substantial support, and level 3 would be requiring very substantial support. And so we know when we talk about autism being a spectrum, and how I mentioned earlier, autism can look very different from one person to the next. That's where we're looking at that level of support. So we might have two people that are diagnosed with autism, or two kids that are diagnosed, but one might require just a little bit of support in some areas, and one might require level 3, so very substantial support. And other symptoms may appear with core symptoms of ASD, like the social communication, restricted and repetitive behaviors. So it's really important to sort of tease some of those things out, because there could be medical or mental health factors that are involved as well. So this is one of the things that you'll receive as a handout, but we have, on the one hand, if you look in the middle, we have the impaired social communication piece of the ASD diagnosis, and 3 out of 3 of those criteria have to be met in order for that diagnosis to be given. So that's social reciprocity, nonverbal communication, relationships, those that have to be impaired. On the other side there, we have restricted and repetitive behavior, and 2 of 4 of these would have to be met. So repetitive speech or behavior, insistence on sameness, restricted interest, and sensory abnormalities. So all of the things on the outside might occur alongside autism, and some of them more commonly occur alongside autism, but it's important to distinguish that they're not part of autism. So things like anxiety or agitation and aggression, intellectual disability, these are things that we might hear about, or we might think about when we think about an individual with autism, but it's not actually part of the autism diagnosis. In terms of sensory challenges that might occur with a child or an individual with autism, this could be across all senses. So could be really strong smells, it could be touch, it could be noise. Some individuals with autism are very, very sensitive to noises in the environment. Buzzing lights or a fan in the background could be very, very distracting, and they may not be able to sort of filter some of those sounds out. Sight might be another. For example, bright lights, maybe, or those fluorescent lights could be really irritating for autistic individuals. Taste as well, and body awareness too. So experiencing pain and what that sort of can look like and feel like. We might, we've worked with kids sometimes that it seems like they will get a bruise, or they've hurt themselves, they have a mark on their body, and they don't know how they got it. They didn't feel it. And the mark seems significant enough that they might actually, we would assume that they would have felt that, they would remember what event caused it, but that may not necessarily be the case. So when we talk about autism, it is truly a spectrum. So that means that the support needs are going to be different from one individual to the next. So some people will have higher needs for support in some areas, and, for example, communicating effectively. Some kids at the age of 4 or 5 might be totally fine communicating in sentences, and another child with the same diagnosis may be working on, 1 or 2 word phrases, or maybe working with a picture exchange system. So some differences can definitely occur there in terms of the degree of severity of some of those symptoms or the supports needed. And this can be dynamic and change for each person over time, or across settings and in life stages as well. You might have noticed as I'm talking, I'm using autistic individual or a person with autism. And some people like to be referred to differently in that regard. So we understand that Canadians on the spectrum have diverse opinions on language and how they wish to be referenced. And so we're just acknowledging that. Many prefer identity first language like autistic, an autistic person, an autistic girl, while others would rather use person first language like person with autism. And some people will identify really strongly with their ASD diagnosis and want to use that autistic term. And seek out that an autistic community to make friends and find support from like-minded people. And then some people may refer or may prefer person with autism if they identify less with the diagnosis as part of their identity. So it's just sort of important to acknowledge that and ask the individual themselves, ask their caregiver or parent what they prefer, because we definitely want to be using language that they feel is appropriate and what they identify and prefer most.
So when a person has autism, they may have difficulty with letting you know what they want. That's that communication piece, thinking, understanding what other people say or want. They often have difficulty taking the perspective of someone else, ignoring sounds or moving things or people, lights. That's that sensory piece, being touched, understanding social rules. A lot of our clients do struggle with kind of social skills and learning how to make friends, how to maintain friendships, that kind of thing. Recognizing and regulating their emotions and feelings, knowing how to play with other kids, and then dealing with changes. So transitions are difficult for a lot of our clients as well. But they may also have strengths in these areas. So they're very detail oriented. They notice fine details. They can focus intensely on a specific topic or tasks if it really interests them. They are very honest. They are curious. They have a sense of wonder. They like to explore toys and new places in a variety of ways. They may think and learn in a visual way. They're very logical in their thinking. They're able to be dependable in their own schedules and routines because they like that predictability and sameness. And then they also are rule following. So to get the diagnosis, Lauren talked a bit about what it all entails, but who do you connect with? So you would look at connecting with your physician or a community health nurse, and they can often make a referral for you to the appropriate specialists, or if you're in Saskatchewan, you would have an autism consultant in your region that you can connect with that would be able to help you as well. So who diagnoses? A pediatrician would, a psychologist or psychiatrist, or sometimes there's a team. So all of these people have to have special training to diagnose. So we'll talk about some behavior strategies next. So first we'll go over the definition of what is behavior. So behavior is any observable action or reaction to a stimuli. Simply put, it can be seen or heard. It's a form of communication. It can be good, bad, or neutral. So a lot of the time you hear the word behavior and you think it's bad, but it's not necessarily the case. A behavior could be drinking from a cup, pointing, or hitting a ball. Those are all examples of a behavior. The ABC model. So we like to look when we're trying to figure out why a behavior is occurring, we like to look at the antecedent. So exactly what happened before as a kind of a trigger to the behavior, what was the behavior that occurred, and what was the consequence. So what happened directly after that behavior and in response to that behavior. So now we will go over the functions of behavior, and there are 4 of them. And then, so for the functions of behavior, we typically like to look at why is a behavior occurring. It's typically, you can put it into one of these 4 categories. So the first one is attention. So for attention, the child does the behavior to receive attention or a reaction from others. This can be positive or negative reaction. So they might hit their sister to get their mom's attention, or they might go and ask their mom for a cookie, again, getting their attention, but in an appropriate way. These behaviors occur when a child is seeking social interaction with another person. So another example here, you're talking to the class and a child cracks a joke and the class laughs at the child's joke. The teacher verbally reprimands the child. This child is receiving positive attention from his peers and negative attention from the teacher. So how to respond if you do have a child or a student or client who is attention seeking. So teaching them to ask peers to play in an appropriate way. So verbally asking or using visuals, if that's kind of what their communication method is, providing praise and positive attention when they ask appropriately. Do not reprimand for hitting a peer, tell the child what to do, not what not to do. And then sensory or automatic. So this one is kind of the most difficult one to kind of change, but the child does the behavior to get immediate reinforcement or sensory stimulation. So they're doing this as a form of regulating themselves, and we all do it. So examples are biting nails, shaking your leg, chewing on items, could be flapping your hands or rocking. All those are examples of sensory stimulation.
And in terms of how to respond, we have to really think about if the behavior is harming the child or harming somebody else. You know, there may not be a need to change the behavior. If it's harmful, we can teach a replacement behavior that sort of provides a compatible sensory input. Like I was just speaking with a parent the other day whose son likes to like grab things. And so we were talking about what can he get that same sensation from, or actually grab people is what he kind of likes to do. And so, you know, is there something he can hold and squish in those moments when he feels like he needs to do that? So it would provide the same sort of sensory input to him. And at the same time, when he's doing that, he can't be grabbing at somebody else. Those are incompatible behaviors. But yeah, we really just have to look at, is it something that does need to change? As Lamasa said, you know, we all kind of do these things. We might bite our nails. I mean, and we may not like it, or maybe the next person finds it annoying, but is it impairing like my learning or my functioning or my ability to function in the environment? No, then maybe it's not that big of an issue. Oftentimes we might change things to be a little more socially appropriate depending on what the behavior is, but it's something that we really have to take a close look at as to how we want to respond. The next sort of function of behavior is tangible, or access to sort of like an item. This is basically where a child does the behavior to receive a tangible item or access to something that they want. So for example, a child might push another child off of a bike and then they get the bike. So they've gained access to that. Or a child might hand in their homework and get a sticker. So sort of that exchange, they get access to a sticker after engaging in the behavior of handing in homework. And how we respond here is we might teach a child to ask appropriately and wait for access to that desired item. And then we would praise the child for asking appropriately and waiting calmly. So we're always looking to sort of what's the skill we have to teach here so that that behavior isn't happening. The next and last sort of function of the behavior is to escape or avoid. So the child might escape a task or the environment or the person. So for example, child covers ears during a loud sound. So they're avoiding that loud sound and they engage in the behavior of covering their ears. A child might hit an adult when asked to do a task. The idea there is that the adult might respond to that aggression as opposed to making sure that the child follows through. So the child no longer has to engage in that task. They get to sort of escape that task while the adult is attending to them regarding the aggression. A child might run out of the classroom when math class begins. So that's an example of maybe avoiding the environment or avoiding the task at hand. And how to respond. We want to teach the child to request a break when needed. Break tasks down into smaller parts. Maybe that task is just a really big, effortful, difficult thing for them, and we need to sort of break it down. We can also give choices in activity and allow for some of that control when it calls for it. If a child's getting dressed, blue shirt or red shirt. Like they have to get dressed, they have to follow through, but they have that choice. And it allows for a little bit more control and maybe a little bit more buy-in in terms of completing the task. So this is sort of just a visual example. What's the reason for this biting behavior? So there's examples of all of the functions here. We've got automatic, it could be dental problems or maybe sensory feedback. We've got tangible, so they could have been denied an item or activity. Escape, it could be to avoid a request from a teacher, or attention, could be positive or negative. And in the past, it's worked to get their needs met, so they're going to keep doing it. But really, we have to consider what is the function for these. And Almasa said, the ABC data, that antecedent behavior consequence, we're always looking to see sort of what came before and what came after, and that helps us point in a direction as to what the function might be. And it could be more than one. Behavior is very rarely just one function. It could be a few at a time. And so we have to kind of look at what's the biggest one, what's the strongest one, what's the one that is affecting them the most, and let's work on that first. So challenging behaviors, they could be present due to communication differences, sensory differences, or anxiety. Typical triggers, these might be like transitions, so switching from one activity to the next. Changes in a typical routine, something kind of comes up and we have to we might be able to go with the flow a little bit easier. Some of our kiddos on the spectrum may not be able to do that. Not getting what's desired or having to wait, and then restriction of interests. So in terms of addressing the challenging behavior, we would want to determine skills that are missing and teach them. We would consider skills to teach based on the common functions of behavior. So we've talked a lot about what these functions could be and then how to respond, right? So we're looking for what's that missing skill? What can we teach the child to do instead? What behavior would we like to see where they can still achieve that goal? If they want attention, we can teach them how to get a person's attention appropriately. Escape, we could teach them how to request for a break. Automatic, we could teach replacement options, like I said, with like the squishing. Tangible, we could teach requesting and waiting. So there's a few different ways to go about this, and we really need to try to uncover why that behavior is happening before we can sort of work to change that behavior. Positive reinforcement. This is a pretty important topic when it comes to behavior change. Positive behavior and problem behavior are influenced by how others respond to that behavior. So we know that it's influenced by the consequences that immediately follow. That's why we're looking at sort of functions of behavior and what comes before and after. We're really interested in that. So one way that we can work to change the behavior is by providing positive reinforcement for increasing a positive or desired behavior. And so we all have things that, might reinforce us. If you go to work and you get paid, at the end of a long, hard day, you get to take that relaxing bubble bath, or maybe you're saving up for a vacation and all of your, savings, and it's really hard to save money, but at the end of the day, you're going to get to take that vacation, right? It's going to be worth it. All that work that you did, you're reinforcing yourself at the end of it to make it worth it.
And then these are some examples of reinforcement, or things that children might find reinforcing. So toys, video games, food, tablets, TV, all these things, activities, sports, that kind of thing. And there also sometimes can be snacks as well. With our young kids, they are reinforced by food as well. So why do we use reinforcement to teach skills? Because what happens after a behavior determines the likelihood of it happening again. So if you teach that appropriate skill and they get that thing that they're wanting, they are likely to do it again. So when a child receives something they think is good, the child's happy with the outcome, again, the behavior is likely to happen again. So this is kind of the most powerful tool we have as agents of behavior change. We want to use it to motivate a child to learn. And again, remaining consistent is key. So if you are teaching that new skill, you want to be providing that reinforcement every time. So now we'll just talk about a non-contingent reinforcer and contingent reinforcer. So non-contingent is when the reinforcement is independent on a behavior. You'll just get it, the reinforcer, no matter what. So an example is Mary wants to watch TV after dinner, and Mary gets to watch TV whether or not her dinner is finished. Whereas contingent reinforcer, that reinforcement is contingent upon that certain behavior occurring or not occurring. If and only if you do this or don't do this, you get a reinforcer. So Mary gets to watch TV after dinner if she eats her dinner. If she doesn't eat her dinner, she doesn't get to watch TV. So we kind of always want to make sure that that behavior or skill that we're trying to teach is contingent on, they get that reinforcer contingent on that behavior. So now we'll talk about another strategy called positive opposites. So a lot of the times as humans, we're really good at pointing out what someone is doing wrong. And telling them no and to stop doing something. So we actually want to do the opposite. We want to tell them what we want them to be doing instead of telling them to stop that challenging or negative behavior. So our goal is to increase that positive opposite rather than punish the negative behavior. A child is definitely more likely to complete the positive opposite if or the positive behavior if they're given that positive opposite rather than if they're punished. So again, avoid saying stop, no, do not when asking for behavior in that moment. You want it to be more of a directive statement or instruction. So setting it up, you want to be calm. That's number one. Kids can feel our energy and we want to remain calm in the moment. Model that good behavior. Use a neutral or positive tone when you're kind of giving that prompt or giving them that positive opposite. Being close without touching. Use a statement, not a question. So asking a question gives the child the opportunity to say no. And you will get that no more times than not, probably. So use a statement and then prompt no more than twice, as 3 times is nagging, and they will kind of learn that, oh, I don't need to do this after the first time they ask me because they're going to ask me a few more times. Now we'll talk about attending and ignoring. So this is another strategy. So attending is noticing when someone's doing something desirable and then giving that person attention. So anytime you give any behavior attention, that behavior increases. So this is that positive reinforcement, right? We're giving them attention for that positive behavior or that appropriate behavior that they're engaging in. So some types of attention might include eye contact, smiling, high five, thumbs up, talking to them. It can look a variety of ways. So you first want to define the behavior you want to increase. So if it's something that you're kind of wanting them to get better at doing, or it's just a new skill that they're learning, you kind of want to decide what that behavior is, what type of attention are you going to use, when to use it, is it going to be during or right after the behavior, and then figure out that positive opposite behavior, and then this is the behavior that you will pay attention to. So if, you know, Johnny's hitting his sister and you see them playing nicely together, you would praise him in that moment because he's not engaging in the hitting, but he's actually playing nicely. So another example, child screams when told to go to bed, will provide attention, praise, or high five when they're quietly, when they quietly follow instructions when told. And then ignoring, sometimes it's called planned ignoring as well. So this is kind of a mild punishment technique. Again, we are not ignoring the child. Just want to say that we're ignoring the behavior. So we use this to decrease behaviors, so taking away attention. So this is when you do not give any attention to a behavior. Usually it's the challenging behavior. You deliberately ignore the behavior in order to decrease it. So you might give that positive opposite once or twice, and then you would go on to ignoring if they are not following through with that instruction.
And so this strategy can be really helpful in terms of particularly disruptive behaviors like whining or maybe bad table manners, complaining, those things that are sort of like we might need to just ignore it and teach that skill of, you know, if your child is being really noisy and interrupting you when you're on the phone, we might need to teach them to wait. So we would ignore the noisiness or interruption, and then we would teach something like, you know, asking for your attention and being able to wait. And so we would really want to attend to that and reinforce it in terms of attention. So yeah, these are some examples of that. Remember to determine if the behavior you're wanting to eliminate is just an annoying habit for you, or if it's really interfering with the child's quality of life. So we really have to kind of take that into consideration in terms of like whining and noisiness and things like that. I mean, kids are noisy, they're going to be noisy, they're going to whine a little bit, but really when that becomes excessive, or if they're doing it sort of when it's not really appropriate, and we don't want them to do that forever. So we're going to need to kind of work on that behavior in that case. Potential problems with this strategy, I would say it's not necessarily problems, it's things we just need to kind of look out for. So, you know, the behavior might escalate when you initially begin ignoring. We have to keep ignoring, and that consistency is really important here. And the reason for that is because if that behavior has worked in the past to get your attention, or to get what they're wanting, and it's no longer working, it makes sense that they would just try harder, right? We would too. Behaviors could get worse before they get better, and your child might engage in new behaviors to get your attention. Again, it makes sense. If what's worked in the past isn't working, they're going to try something else. So this can take some time and it can take some effort, but if we are consistent and we stick with it, the long-term results are worth it. We do, when we're taking data and we're sort of graphing, you know, how often that sort of challenging behavior is happening, we do see that behavior go down. That line on that graph does go down if we can stay with it, and be consistent. And then also we need to be providing that attention piece at the end. So what are we attending to? What skill are we teaching? We need to be teaching something in place of decreasing something else. So as I said, yeah, these skills they're useful together. You're going to want to use them together in order to see success. Our next strategy is something called shaping. And this is really the process of teaching a new behavior by reinforcing small steps toward that behavior. So it involves reinforcing minor improvements toward a longer term goal. So for example, like time spent in circle time. Circle time could be 5 minutes, 7, 8 minutes. Maybe the child, we're going to start out at like a minute. And that's all they can handle. And that's fine. Let's start there. Let's see some success. Let's reinforce that for a while. And when they're being really successful, we can sort of up the ante. So we could say, okay, we're going to increase it by 30 seconds, or we're going to increase it by another minute. So then we would reinforce at the end of 2 minutes, for example. So we're kind of increasing and systematically increasing the expectation there in order for them to get the reinforcement. It can be a really useful technique for behaviors that are inconsistent, non-existent, so it's something new, or for something that's really complex and has a lot of steps. So this could be like getting ready for school, or any kind of routine like circle time, gym, recess, bedtime and toileting routines. These would require a few steps, right? So if your child is not able to engage in the entire routine, we might just reinforce a small section of that. And then as they get more consistent, we can add more steps and sort of delay that reinforcement. Cleaning up their space, picking up toys, could be like there's 10 toys laying around and they need to clean up 1. And that's where they're starting. So we would then work to increase that all the way up to the point where they are picking up all the toys on their own independently. This is the example of the circle time that I had sort of said. So if you look at the very last step, if we think about the goal, that's where I always like to start. Okay, we want to sit at circle time for 5 minutes. Where do we start? We would start at step 1, circle time for 1 minute. We're going to reinforce this until it occurs consistently. consistently. And so in that case, we would say 4 to 6 days. If they're doing that independently for 4 to 6 days, we would sort of consider that consistent, independent, and we can be reinforcing that throughout. So, okay, they're doing this for 4 to 6 days. That's awesome. Let's increase that expectation. Step 2, we're going to do 1 minute and 30 seconds. So they're only receiving that reinforcer after 1 minute and 30, no longer at 1 minute, because the expectation is increased. Again, we want that consistency over 4 to 6 days, and then we can bump it up to step 3, step 4, and all the way up to 5 minutes there. And you'll notice that the reinforcer doesn't really change, and we don't want it to. It's okay if the child switches interests. We all do that. We're going to change our mind, but we don't want to be providing like 5 stickers after 5 minutes of circle time, right? We want to frame it really positively and be like, hey, you're ready for this. Like, I know this is challenging, but you can do it. This is how you're going to get your sticker now. So we're not going to increase that reinforcer. We're going to increase the expectation. So a few more strategies. We've got emotional regulation. Some of the kids on the spectrum really will struggle with difficulties with regulating their emotions and sort of what's appropriate in certain situations and how to tolerate certain stimuli. So these could be like sudden noises, like an alarm or siren. If you think about if you're out for a walk and a fire truck is nearby, or if the fire alarm goes off at school, could be unfamiliar food texture or a change in schedule, unfamiliar person, events that are upcoming, or even rooms with too many people. So too crowded or maybe too noisy. These are just some examples of some of the things that a child could find overwhelming, and we might have to look at some emotional regulation strategies. So in these types of situations, we can help children learn how to keep calm or stay calm using the following strategies. Visual schedules can be really helpful. And I mean, there's more strategies than this, but these are some of the more common ones and the ones that we point to right away if they're not already in place. So a visual schedule could be really helpful. And this is really just a step-by-step display of what is going to happen. And if you think about your own, planner or calendar app on your phone, your own agenda, we all kind of use these things, right? Where we have everything set out. And it can help in terms of providing some predictability to the environment, and the child knows what to expect. It can help sort of ease any of the difficulty with transitions that child might have, because they know what's coming next, and we can point to that and we can warn them about that. And we can have them participate in it as well. Timers, this kind of just gives a heads up. It can be a visual reminder and an audible sort of reminder in terms of when a task is over and we need to switch to something else. So we might use a timer for some of those transitions when it's switching from a non-preferred task or something they're not really wanting to do to something that they do want to do. If they want to just get right to playtime, we can be like, okay, well, first we need to, I don't know, we could be working on a pre-academic task, like a matching puzzle or something like that. So you could work on that for a certain amount of time, set the timer, and once that timer goes, you can go do that fun thing that you wanted to do. Social stories is another one, and this is something that is very tailored to the individual, so we can create these, and it helps children just understand what to expect in certain situations. And one of the resources that we have for you is an example of that. So what to expect when going to the grocery store, what's involved, what is my role in this? How do we get through this, and what can I expect through it? And if I have trouble with it or difficulty with it, what can I do to help myself in the moment? So these are just a few examples of ways to work with kids that have some emotional regulation issues.
So this is just an example of a visual schedule. So you can see the student has, looks like a dressing schedule. So it has all the steps that they need to get dressed and the order. And once they are done each step, they would get to take it off the schedule and put it away. And then they would get to go and do their fun thing. And then this is just examples of timers, so they can look very different. You can use a timer on your phone. You could use the visual timer with the red there on the left. That one is a popular one that we use. So the red is the time remaining and it keeps going down. So it's a very visual, so they can see it, the time going down, and it just makes more sense to them. Rather than saying, you know, you have 5 minutes left, you have 2 minutes left. Sometimes kids don't understand the concept of time. And then you can just use regular like hourglass. So an example, we will be giving you an example of a social story, but basically, like Lauren said, it just helps you kind of understand what is your role in what you're doing, and helps you understand what to expect in that situation. So sensory overload. So children with autism can sometimes overreact or underreact to sensory input. So they'll either seek or avoid sensory input. So this can affect them tolerating a variety of sensory input, sleeping patterns and routines, participating in community events. So maybe they don't like to be around lots of people. Maybe it's too loud. Making friends, adjusting to different environments. So these can all be things they struggle with because of their sensory overload. So to help them with this, you can create a quiet space to go for calming down. Usually we provide a lot of like sensory toys or fidgets, allowing extra time to process instructions or conversation, visiting new places at quiet times, gradually kind of increasing the length of time spent in the new environment. So that's that shaping that we just talked about. Trying earplugs or noise canceling headphones to help with sound sensitivities is also really useful. Arranging calm days to counteract busy days to kind of reduce that social or sensory anxiety. And then seeking help from an occupational therapist. They're just a great resource for anything to do with kind of that sensory, any sensory challenges, that emotional regulation, those kinds of things. They're really, really good and have lots of good strategies as well. So now we're going to talk about communicating with others, how that might look and what you can do. So one of the main features of autism is difficulty gesturing, talking to, or understanding others. This can affect how they interact with others, how they tell or show people what they want or need, how they handle frustration, how they make friends, connecting to family members, how they play. So their play may look different than a neurotypical child. Joining in play with others, they might want to play, but they just don't know how to initiate that play. So you can help build or encourage communication by using visual forms of communication. So pictures or the picture exchange communication system is very useful at the beginning if a child just kind of has those pre-communication skills like pointing and reaching and that kind of thing. This is a great thing to teach. So you're teaching the child to exchange a picture for the item that they want. And then there is that two-way communication with the person because they're having to hand over that picture to get that item. So signs or sign language, gestures like pointing or showing, in augmentative and alternative communication, also known as AAC device. There's many different apps out there that you can definitely get support from an SLP to get that going. So now we'll talk about play and social communication. So what play looks like. Children with autism may play differently. They may have that preference to play alone. They may have rigid play routines. A lot of times we see kids lining up toys. They might just play with toys in unusual ways, not functionally playing with them. They may spin toys or parts of toys. They may place toys in a certain way. And then play is a child's work. So play competency is key to peer interaction. So the ability to use toys interactively and activities in a functional way is important to successful peer interaction. So this is something that we teach in our therapy sessions, is teaching functional play and the this is just hopefully going to help them with that social communication in the future. So teaching the child what to do first before expecting, sharing and turn taking. So modeling is a really good thing to do, modeling and kind of repetition, supporting exploration and play successes by providing a motivating environment, incorporating the child's interests and activities you would like the child to explore. So we do a lot of preference assessments in our therapy sessions. We do it at the very beginning, and then we also do it kind of throughout our therapy block, just because preferences do change. Depicting steps for play by using visuals. So again, you can have different like play sequences, breaking down how to play with certain toys. So some more visual strategies. So choice boards, so you would broaden the range of possible choices a child can have and act as a reminder. So it provides the opportunity to teach acceptable requesting. So you don't want to just have what they can have on the board. You want them to also have what they may not be able to get, because a verbal child would be able to say, I want a cookie, and mom would say, well, not right now, it's almost supper time. So they also need to be able to understand that no is sometimes the answer they might get, or not right now. It provides a reliable way to indicate something, again, isn't available, and then maybe suggest something else. So a choice board can look like this, many different examples, but it can be I want, and then they have some options there for different things, and the child would just get to choose what they would like and put it on the board. And then the one on the right is a little bit more advanced, so they would put I want, and then the color, and then what they want. So they are visuals that enable an individual to empower themselves with the choice making. Choice making is extremely important to teach independence and to reduce or prevent negative or challenging behaviors. All the choices must be available, like I just said. Include choices that are equally motivating. So you want to have many things that the child would enjoy. And the number of choices can vary depending on the individual. So this is another example of a choice chart. Another visual guidance for lining up. And then this is a first then. So first wash your hands, then you get a snack. This is also really good to use. And circle time as well. So you can see there that they have the little yellow circles on the floor to show kids where to sit. And that is our presentation. That was a lot of information in a short time, but we did provide you with the handouts, with the slides, and then extra handouts as well. Oh, Jackie, you're muted.
You would think I would know this by now, the number of Zoom meetings and webinars I've been a part of. So right. Amazing. Thank you. We do have a few questions, and I will be, as you're answering, I'll be uploading some of the documents, some resources, fantastic resources, but hopefully we'll be able to get to all of these because some fantastic questions. So the first one is, what is neurogenetic testing and what is the purpose?
So neurogenetic testing, all I really know is that it is kind of studying brain disorders and how chromosomes and genes affect different disorders. So that's all I really know about it. And yeah, autism would be in there. And I know there's a lot of research going on about certain genes that contribute to a child being more likely to be diagnosed with autism. Lauren, did you want to add anything else?
Not really, no. I just, yeah, there's definitely research going on about how autism sort of factors into that. But there's no like set, there's nothing definitive and no like conclusions necessarily made in terms of like a cause or anything like that. Yeah.
Thank you. The next question is, how is it known to be autism if it is just a behavioral issue that is able to be addressed and worked on? Or would first behavior problem be not reading this correctly, but, or would the first behavior problem be put towards a diagnosis of autism?
So typically you would be seeing more than just the behavioral issue. And again, it would be determined by the physician or the psychologist or pediatrician or whoever is diagnosing, or the team. If it is just, if they're seeing all the other kind of characteristics of autism or not, versus it just being a behavioral problem.
Yeah, and I think one of the things that's important is some people might be accessing, like speech delay is a good example of this, right? So we know that social communication does show up as one of the main pieces of the diagnosis. But again, if you're seeing an SLP, speech language pathologist, for like speech delay, that SLP may speak with you about, you know, I'm seeing other flags here, right? So it would be something other than that, in addition to something like a speech delay or like a behavior issue. So any other service providers, teachers, daycare providers, they would also, you know, they might point things out, but you would have to sort of be looking at sort of that diagnostic criteria, and you would have to meet like a number of those in order to really be considered and sort of flagged for that diagnostic assessment.
Excellent. Can you give an example of a positive opposite? The example given here is when my child runs out in the middle of a busy road.
So this one is kind of tricky. You can definitely try to use a positive opposite about, like, you know, please get on the sidewalk or something like that. But when it is a safety concern, that I feel like is one time where, you know, you might yell the word stop, and that would be kind of where you want your child to respond to you in that way. But the positive opposites are more for the behaviors that you are easily more controlled, and you know, your child is safe. But when it is a behavior like running into a busy road, that's a safety concern. And in my opinion, yelling the word stop would be appropriate in that regard. Lauren, is there anything else you would add?
No, I don't think so. I think it's just, you kind of just do the best you can, and you have to gauge on what's happening. Like safety is always going to be paramount above anything else. So you're not going to stand on the sidewalk and be struggling to think of a positive opposite. You're just going to react as you should. You're a parent, caregiver, and you're just going to do what you have to do to keep your child safe. So and definitely, like, if there are behaviors that are not necessarily safety related, it can take a little bit of time to think of those positive opposites. But in the moment, if you just need to react, just react, do what you have to do, right? Again, you'll want to be working on teaching your child like road safety and things like that, but when that's actually happening is not necessarily it's not one of the considerations. You're just going to get out there, say stop or whatever. So
excellent. Right, so Emery's asking, I'm curious about how these techniques affect attachment to caregivers, as some of these strategies do not promote things like co-regulation and joint attention. Are there any studies or additional resources you can share that expand on how these strategies relate to attachment?
That's a good question. Like, I think in all of these cases, it's important to be calm and be very open to explaining to your child, you know, why they shouldn't be engaging in a certain behavior, and also be acknowledging that, you know, these things might be difficult for them. Like, I know you're having a tough day today. I know this is difficult. This is why we have to do this. Again, like with planned ignoring, it can sound kind of harsh, but we're not ignoring the child, we're ignoring the behavior. And then we do have some, I think, additional resources on co-regulation that we have shared in the past. So that is something we could pass along. Lauren, did you want to add anything else?
no, I think one of the things, and I thank you for bringing that up, is that we do want to preserve like the parent-child relationship. And so even some of this around like positive opposites, for example, that's one that I kind of point to in terms of like just sort of taking some of the stress off things, and you're focusing more on the positive and what needs to be taught, as opposed to like reacting more to the behavior that is happening. So we're always wanting to be a bit more proactive than reactive. But definitely like always trying to consider that parent-child relationship. But yeah, and there is even one of our consultants teaches a program or a sort of a workshop about co-regulation. And so there has been a lot of strategies coming out of that area as well that we definitely acknowledge and want to be teaching caregivers as well.
Excellent. So this somewhat fits into this a little bit, but so this person had indicated they found the information very relevant for autistic children requiring less support, but not as fitting for individuals requiring additional supports. Can you expand on how attending ignoring would be beneficial for a child who is unable to establish joint attention?
For this, I would say just getting down to their level. And at that point, like if you feel they are not able to understand the attending and ignoring, I would say redirection would be probably your best option in that case. But yeah, I think it is something that comes with time, and joint attention kind of also is a skill that needs to be taught. So I would still focus on attending for sure, because they're going to understand that mom is happy, mom is excited, or dad is excited that I did this thing, because you know, they're very close to you and they love you and they want your approval. So I think yeah, focusing on attending is still really important, and teaching joint attention is also, yeah, a skill that needs to be taught.
Excellent. So a couple more questions here, and then I know some people have need to get going, but what is the best way to make sure that your child doesn't get lost in the public school system or misunderstood for being an unruly child? Do you have any suggestions?
Yeah, this is something that we kind of run into a lot with our clients, and I think like just advocacy, right? Like just advocate for your child in the best way you know how. Reach out for support if there is you know, an autism provider near you. I would really encourage you to get in touch with them, because a lot of times schools and outside organizations really do respond better when there's kind of a third party involved as well. They're more likely to listen to the parent, and that change is more likely to happen. But I would just say, yeah, to advocate for your child. And if you know that there's something they need in school and they're not getting it, I would continue to like make that very clear. Again, it's really difficult. It's dependent on what the situation is, but that support from any autism provider is going to make a big difference, I think.
Yeah, and again, this follows very much with what you're saying, because this person's asking, what should parents do if they think their child has autism? So definitely connecting with a third-party organization. But do you have any other suggestions?
Yeah, so if you do think your child has autism, the first step would probably be going to your family physician and getting a referral, if you can, to that specialist or that team. You can also access it privately as well. It is very expensive, and you would have to have, most likely if you have insurance coverage, that would be awesome, and you wouldn't have to wait as long, but there is typically a wait. We are seeing it kind of be a little bit quicker in Saskatoon here with the younger kids lately, so that's really good with the team and some of the pediatricians that are diagnosing, but sometimes the wait can be long. So, but yes, first step would be to go to the family physician and kind of express those concerns there.
And just to acknowledge, like not every, and like we understand not every community might have a family physician. There might be like visiting professionals or doctors that are sort of like traveling. So it might even be like the community health nurse that's in the community, or there will be a resource coming along that gives like contact information for all of sort of like the major sort of autism services providers in the province. So whichever one is closest to you, you can even ask, hey, how do I go about this? Just reaching out to either a medical professional or that autism service sort of program in your area would be appropriate, and they should be able to point you in the right direction. In some cases, you might need to travel a little bit to get that diagnosis. In other cases, there might be traveling professionals that would come out to an area near you, where you could sort of have that assessment done.
Excellent. So there's a couple more questions, but I know people are leaving. So I just really, there were lots and lots of thanks in the chat. And obviously lots and lots of questions. So if we can't get to everything, we can, if you want, we can record you after this. And then when people get the recording, they will get the answers to the final questions. I just want to thank everybody so much for joining us this afternoon for this incredibly important topic. I love all the strategies and information and resources that you've been able to provide. That really has been fantastic. I just want to put a shout out for a conference the Prevention Institute is putting on this fall, Parenting Matters, Honoring and Promoting Children's Rights. And that's an in-person conference. We're so excited. That will be held in Saskatoon on October 11th and 12th. And I just am putting the link, but you can go, registration is open, and we will have some more information very shortly on the speakers and stuff. So that's sort of right in the middle. If you don't mind, Almasa and Lauren, there is 3 more questions, which I think are important, but I just know I see people are leaving. And so I just wanted to be sure to get that information. So for those of you that are able to stay, the next question is, do you have any Zoom trainings for working with students with disabilities? And also, do you have anything for students in grades 7 to 12 that are on the spectrum?
Well, in terms of trainings, I mean, we generally would get requests for those. And so if you're interested in sort of getting a request, we kind of refer back to people's sort of local community and local autism service provider. So, I mean, that would be, I don't know where this person is located, where you're asking that question from. So my first thought is to go to the autism professionals in your community and see, and then yeah, but I mean, we obviously take requests for community trainings as well. So so that's the answer to that one. And then I'm sorry, was it grades, Jackie? What did you say?
Grades 7 to 12.
7 to 12. And we're looking at presentations or resources?
Check the way it was worded. Lots of questions here. Sorry. I've lost it. I had the question and now it's gone.
Sorry.
No. Because I'm trying to. I'm not sure. I think it might be resources, but for some reason it has totally deleted off on my list here.
Okay.
I do know it was grades 7 to 12. So maybe if that person is still on, they can just send us an email and or send me an email, and I can pass that on to Lauren and Alamasa, and they can answer that directly.
Yeah, that sounds good.
Right. Now here's another question. Child was diagnosed with PDD/NOS age 4 in 1998, DMS4. With DSM-5, is it ASD spectrum level 1? Am I saying that correctly?
The levels I'm unsure about, because I'm not a diagnosing professional, and so I'm not very well versed with that. However, what the DSM-5 did was collapse all of those. I think there were 5 separate sort of autism diagnoses that fell under the autism umbrella. So that's where, like, you may have heard Asperger's before, and then like autism and PDD, which is, I think, pervasive developmental disorder, not otherwise specified. So that's really the change that happened in terms of that diagnosis piece. And so, I mean, it would fall under an autism diagnosis, I think, at this point. The level of support I couldn't comment on necessarily. But if you are interested in sort of pursuing that and getting that more specific information, you may want to reach out to the provider or the autism service provider in your community to get either like a reassessment or just a confirmation of that diagnosis. or even just to maybe just to ask that question of a diagnosing professional in your community. I wouldn't want to comment on that just because I don't have great knowledge of necessarily how all those pieces fit together between the DSM-4 and the DSM-5.
Thank you. And thankfully the person was still here for the question that I had accidentally deleted.
Okay,
so
okay.
It was about Zoom trainings for working with students with disabilities, and also I guess working with maybe those students directly in grades 7 to 12 that are on the spectrum.
Yeah, I guess I would reach out to the autism professional in your community. So if you're Saskatchewan region, that would be like us. And we can kind of see, like, when we do community trainings, we will generally sort of tailor, and sometimes it's us creating things for like trainings and groups and things like that. And when you speak about or ask about sort of working directly with learners in that age range, again, I would reach out to the autism service provider in your area to see what is part of their program, because each sort of region in the province will sort of house a different like sort of service model of supports that are available. So I would say that resources, groups, things like that may exist. It's just what is part of the program in your geographical area. And sometimes if something isn't available, it may be that there hasn't been a request for it, or yeah, I'm sure that all of the autism service providers in all of our communities are open to hearing feedback and sort of what they're feeling is needed, what the community is feeling is needed. So please don't hesitate to reach out to those professionals in your area and just kind of have that discussion about what you think might be beneficial.
Perfect. This person saying is interested to know if Autism Services of Saskatoon practices ABA. Also curious to know if your program employs any self-advocates, autistic individuals.
So we do practice ABA. We have our skill acquisition therapy that we have for our younger kiddos, and we do use principles of ABA. Our therapy sessions are very child-led, play-based, and then we also incorporate parent coaching as well. And a lot of actually the topics we talked about today also fall into the principles of applied behavior analysis as well. So yes, we do. Oh, and the question about Lauren, do you know that one?
Yeah, is any individuals that identify living with autism, do they work at autism services?
There may be. I just don't know if they've disclosed information like that. So not necessarily self-disclosed.
Perfect. What accommodation should we be requesting from the school for their child? He is 9 going into grade 4.
I think that really depends on what it is that your child is needing. If you would have to know, what are they kind of having difficulty with, if anything, and then we would be kind of basing the accommodations on that. So again, that is something that if you're connected with an autism provider, they would be able to help kind of give suggestions or for accommodations and recommendations for that. So yeah, it would usually consist kind of a team meeting with the teacher and the parents and the autism provider, and then kind of just discussing what it is the child needs and kind of putting a plan into place that, everyone is on board with and has contributed to.
Yeah. And I would say if you're not connected to an autism service provider, I would say that even just making sure that open line of communication with the school is there first, even if you're trying to get other professionals involved or anything like that, just making sure that there is that communication so that you're aware of what's going on at school, and then school is also aware of maybe what's successful at home, right? Like oftentimes as like consultants, our team or one of our team might go into a school meeting and be saying, well, this is actually what's really working for mom and dad at home. Is there a way we can implement this at the school, right? So it's really about some of that consistency as well. So yeah, not only getting involved with an autism professional, but just making sure that that communication is there as well as a starting point for sure. So it's, yeah, I know it's not really like a super concrete answer, but it's difficult to comment on something like that without knowing the specifics of your child's needs, right? So that's exactly what Amasa said, get involved with an autism service provider, and they'd be able to comment and kind of get to know your child a little bit more. But yeah, also don't be afraid to ask for things and see what's available. Ask what's possible. And see what the communication is like with the school in terms of accommodations.
Perfect. And this question actually fits with they're asking, can they access any therapy services through Autism Saskatchewan if they're waiting for an assessment?
Yeah, so we do serve Saskatoon area, and so that is sort of the geographical area that we will provide services for. So in terms of our organization, yes, we understand that wait lists are long, and you can certainly access our services if you fall within that or reside within that geographical area. If you're on a wait list, as long as we're able to confirm that you're on a wait list, we can wait list for assessment. We can, we can get the intake process started and get everything started for you, and you can be accessing supports up to, like, you know, when that assessment happens. And then if that assessment does end in a diagnosis of autism, then we just continue that support. And if it doesn't, then what happens is we would transfer and sort of refer to other appropriate supports in the community. So we would look at sort of transitioning and making sure that you are linked up with other supports and things that would benefit.
Perfect. Yeah, I just see there's another very similar question in the chat, just saying this person knows a child that's been on a wait list for over a year, and the private assessment costs are very expensive. So are there any other options available for school-age children to see a professional without a diagnosis? So it sounds like you would be encouraging them to contact their autism consultant or person in their community.
Yeah, I would say that. In terms of assessment and waiting, yeah, there are a few ways to go about that. I would talk with a healthcare professional if there were any other options available, and I would talk with your autism service provider in the community as well. They'd be able to help direct you toward other assessment options if they were to exist. But it's also important to note that Jordan's Principle, if individuals are eligible, I believe they do cover funding for assessment as well. So if you're looking at something like a private assessment, I just know that I think Jordan's Principle does have a bit of a wait time, as most like service providers and sort of funding providers also do as well. So that's another consideration, is if there's other funding or insurance or benefits options for people to access. You might be able to do that. And again, you could speak with your local autism service provider for that, to see if they have a better direction for you in terms of your own community.
Excellent. Oh, one more question. Where can a child under age 2 get a proper autism assessment in Saskatoon?
Okay. So I would talk to your physician to get that referral, and they might be referring to like Alvin Buckwald Child Development Program. They may refer you to a pediatrician or a psychologist. So there are like various options. It's just something that you would want to discuss with your healthcare provider. And so if you have a family physician, you'd want to do that. I believe that a walk-in doctor might also be able to advise. But I would probably advise you to call a clinic if you were going to go for a walk-in. Walk-in times can be lengthy. So don't want you to wait just to not get your referral at the end of it. But I would call and find out for sure. So.
Fabulous. Thank you so much. Really appreciate all of the answers to the questions, and of course for the entire webinar. Lots and lots of information shared, and obviously lots of engagement from participants. So thank you very much for joining us. We look forward to being able to share this information. So those of you who are on I will be sending out the link as soon as it's available, and I'll attach all of the additional handouts as well. So
Great.
have an awesome afternoon. We are excited that you were able to join us. So take care, everybody.
Thank you.
Thank you so much.